Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's episode, we're going to be discussing a medication known as Eprosartan, or Teveten. And before we talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. In this video, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Eprosartan. We'll then touch on examples of dosing, and then finish it off with side effects. Put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Eprosartan mesylate is an angiotensin II receptor antagonist. They're also known as ARBs in this class. It prevents the binding of angiotensin II to the AT1 receptor. This results in vasodilation and inhibition of aldosterone secretion. In terms of indications or reasons we would prescribe this medication to a patient, we often see this medication used in the treatment of hypertension or high blood pressure. In terms of contraindications or reasons we would not be able to prescribe Eprosartan to a patient, we wouldn't give this medication to a patient who had a hypersensitivity to Eprosartan or any other component of the formulation. If a patient was using aliskiren, a diabetic patient that is, this would also be a contraindication in that setting. Now for an example of dosing, so in the treatment of hypertension, the initial dose would be 600 milligrams orally once daily. The usual range would be 400 to 800 milligrams orally once daily, or in 2 divided doses. It should be noted here that dosing may change if a patient is volume depleted, or Eprosartan is being used with other blood pressure lowering medications. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Eprosartan, so I'll go over some of those here now. 2% may experience myalgia, while 4% may experience dizziness. Fatigue seems to happen 1.5% of the time. As well, patients may experience abdominal pain or an upper respiratory infection. 2 serious side effects would be edema of the face, although this is rare, as well as neutropenia. This may happen 1.3% of the time. Alright everybody, that's all we're going to talk about today with Eprosartan or Teveten. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.